Our next session takes us to New Jersey, where a 37% premium increase for local government workers and a 27% increase for state employees created both a crisis and a catalyst. Panelists will discuss how a coalition formed to address this issue, how they're building bipartisan support, and what strategies might transfer to your community. Moderating is Anna Maria Hill, New Jersey State Director and Vice President of 32BJ SEIU, representing over 15,000 workers. Joining her are Deborah Cornavaca from the New Jersey Education Association and Jillian Barrick from the New Jersey Municipal Management Association. Please welcome our New Jersey panel.
Thank you. All right, and they start the clock the minute you start walking up here. So good afternoon to everybody. My name is Anna Maria Hill, and I am State Director and Vice President for 32BJ in New Jersey, in the house. We want to make sure folks are up and lively.
32?
BJ!
There we go.
You know, I wanted to do that, Deb.
Oh, I'm sorry.
But I was so worried that nobody would know to answer my 32. So
We got it covered.
Thank you.
We got you covered.
So thank you so much for joining us. This panel is called There Is No I in Team. And so I really want to thank the Mikey Sherrill campaign and Lieutenant Governor Hopeful Dr. Dale Caldwell for joining us this morning. We know that if we want to make changes and improve the lives of people, that it comes with all of us coming together. Employers, unions, coalition partners, and our elected officials to really join us together. I also want to thank Assemblywoman Reynolds-Jackson, Assemblywoman Carter, and Assemblywoman Murphy for introducing the healthcare accountability legislation in New Jersey. In the Assembly, it is A5376. And I also want to thank Senator Vitale and Gopal for introducing it in the Senate as well. And in the Senate, it is 4299. So thank you to my New Jersey folks. I hope there are some New Jersey people in the room. Whoop, whoop. And thank you for crossing the river and coming over to join us here in New York. Now, on the stage with me, as my moderator already mentioned us earlier today, is Deborah Cornavaca, who is our Director of Government Affairs for NJEA, the New Jersey Education Association, representing over 200,000 teachers on the New Jersey side. Very powerful union. Thank you for joining us today. And we also have Jillian Barrick, who is President of the New Jersey Municipal Managers Association, and she is also the Business Administrator for Morristown, double R, not double O, for folks that know that there's two Morristowns in New Jersey.
Well, there's only one that counts. Just kidding, just kidding.
Morristown is very lovely, actually. If you go over there, there's a beautiful park, lovely people, and a very lovely mayor who has also stood with workers. So why are we here today? Now, healthcare accountability, healthcare affordability is definitely prime issue for all of us. It's an issue that we all care about. And as Manny referenced earlier today, it really has to come with all of us sitting at the table together and in partnership. It means that the opposite sides sit together, right? It means that employers, like our business administrators, are sitting here with the unions. It means that our elected officials are also at the table trying to come up with real solutions for people. And it's been our experience that if we come together, we can tackle healthcare affordability, and that there is a healthcare crisis in the world that we have to tackle together. Now, before we get started, I'm going to ask questions, but I want to frame the reasoning this coalition came together in New Jersey. So this coalition formed in 2022, close to 3 years ago, and it was when the state health benefit plan had these huge hikes that we had never seen before, double digits. Now, we thought that it was ridiculous that we were hitting those numbers back then. And yet, just this past July, the numbers went even higher. So numbers were introduced, the rate hikes went up 36% for local municipalities, 21% for our state municipalities, and 32% for our school employees. Now, we know that it is a struggle to put food on the table. But when your paycheck is not growing and it's actually shrinking because more money is going to your health care, that becomes a problem, right? And so this coalition came together. NJEA was one of our founding partners on this coalition, but it also brought together public unions and private unions. It brought together the police union that comes right next to the teachers union, firefighters union, New Jersey Working Families Party, the New Jersey State Benevolent Associations, our police officers, our state troopers, our firefighters, Blue Wave, and advocacy groups like New Jersey Citizen Action. We all came together and said, this is a problem. How are we going to address it? How are we going to hold people accountable? And so that happened, and here we are with legislation sitting there waiting for us to really push it and get it through. So now I'm going to hand it over and ask a few questions. So Deb, why was it important for NJEA to join this coalition and to really take on healthcare affordability?
It was easy to join, to say yes to an ask from 32BJ, first of all. And I do want to give a shout out to everybody in 32BJ who's put together such an amazing day here today. I know it's an immense amount of work, but it's been amazing. Yeah. So I don't know if you want to join me in a little round of applause for 32BJ for all of this work. I'm giving a little of my time up to appreciation, but it was easy for us. The first reason is that it's unacceptable to us that any member or any student or any student's family should defer health care, be fearful of going to get health care because of the bills they might face. That is unacceptable. And that is the world we live in right now, because even with insurance, people are scared. I don't know what they're going to charge me, right? Or I know I'm going to get a huge bill, or don't put me in the ambulance because that's not covered. That's an unacceptable place to begin, especially we feel for educators who dedicate their lives to educating children, to taking care of them. And by the way, if you spend a lot of time in classroom, there's a whole lot of germs in that space. So you do end up getting sick a little bit. That was the first reason. The second reason is that we sit on the Health Benefits Commission that helps design the health benefits for the school health plan. Even with a seat at the table, we know what good negotiations are. You kind of share information, you try and get information out of the other side, and you figure it out. But except we're completely and always stymied. We're told you can't know that. That is proprietary knowledge in contract between the insurance company and the hospitals. So 1 year utilization goes up, your rates go up. The next year urgent care use goes up. Why? Because you made the hospital so expensive that now they're going to urgent care. So now your rates are going up. This year utilization is going down, but your rates are going up. And we keep asking, show us where the real cost drivers are. We can't do that. That's proprietary. So that's infuriating, and it also makes it impossible to be part of a solution. And the third reason is, while we're nearly 200,000 strong in our membership, and you multiply that by their family members, and also we consider the students we educate to be part of our family, so we're a lot of people, can't do it alone. We cannot stand up to the consolidated hospitals that exist in New Jersey and do it alone. So we were thrilled that 32BJ wanted to bring the coalition to New Jersey, put public sector, private sector, nonprofits, government sides all together, because we all share in the problem. And when we sit down to negotiate, we're all held hostage by the same problem. There's this entity out there, not at the table, making the pie impossible to fairly divide, because they keep taking a bigger piece of it, right, and telling you to make do with the rest. And so we knew this was a space we had to be, because it was one of the first attempts in New Jersey to look at the underlying root causes of the costs rising so quickly, instead of just chipping around the edges and playing a shell game with the costs that they're inflicting on us. So we are thrilled to be here, and it is so powerful to sit in front of legislators and they go, wow, you got the firefighters and the teachers union there? Wait, you got public and private sector? They're not used to seeing this kind of coalition. And that's the kind of power we need, a little bit of shock value to stand up to the hospital coalition and the hospitals that are so consolidated in the state.
You know, I have a 3-year-old and a 5-year-old, so I know what you're talking about on the germs. So I definitely salute our teachers for everything that they are doing. And bargaining contracts in New Jersey, 40 cents of every dollar that we are negotiating is going to healthcare. And when you go to the employer and say, our members need stronger wage increases, they need better raises, they're saying, well, figure it out, because this is the only pot of money I have. And so you're right. We're fighting for little crumbs and trying to figure out a little more. But, Jillian, I know you're facing this on your side too. As an employer, how do you deal with an entity telling you this amount of money you have to chop out for healthcare? How are you dealing with it?
I really echo the sentiments you guys have already shared. You know, government is, we employ people to do the business of government, right? So 60% of my budget goes to personnel costs, both salaries and wages and healthcare and pension costs and other benefits. So people talk about how high property taxes are in New Jersey. Well, why do you think that is? Because our expenses keep going up and up and up and up and up, and it's not matching the level of growth in non-tax revenues. So where else are we going to find the money to cover all of these costs? It's not enough to move the chairs around the deck of the Titanic. Like, that's not sufficient. You know, Morristown, thankfully, we're thriving, we're diverse. You know, we've been given all these accolades. We're number 9 in the community for families, or number 9 in the country for families. You know, and it's great, but a lot of our communities don't get those accolades. Yeah. But the reality is that we are all collectively struggling with the same problem. And we have to come up with a solution that's gonna get at the underlying cost. You know, if you haven't heard, there's a governor's election, and the number 1 topic is affordability. Yeah. And when you talk about affordability of government, that can't mean that then I'm gonna turn around and pass along a 36% healthcare cost increase to our taxpayers. I mean, thankfully, Morristown is not the state health benefits plan, hallelujah. But we still saw a 20-some% increase last year, which it would have been, if I hadn't absorbed it in other places, it would have been like a 7% tax increase. Thankfully, I was able to absorb it, but I can't do that year after year after year. It's not reasonable, it's not realistic, but I also can't realistically expect my employees to continue shouldering the burden of reducing their wages just to cover the cost of healthcare. That's not reasonable, it's not sustainable for anybody. Yeah.
And we know that in partnership, we can do this together. And we believe our employers when they're sitting at the table and saying, I just can't. Right. I can't. And so do you absorb? What do you do? Do you pass on the buck? We love our hospitals. So don't get me wrong. This is not an attack on the hospitals. We know that we depend on our hospitals, that we depend on our nurses and on our doctors, and that when I'm sick, I want to be able to go to the hospital and not have to worry about it. So when we came together and really analyzed the little bit of data we have access to, like Deb, transparency is a big thing, we realized that one of the growing costs in relation to the medical field was hospital pricing. That it was that thing that in the past 10 years, taking into consideration inflation, hospital prices have gone up 100% when things like housing and food have gone up only 40%. Only. Yet when I go and buy the milk for my kids, it's $6 and my boys love to chug milk. So 40% on the food, but 100% on hospitals. And so this coalition came together and thought there has to be a way to really rein in the cost, to love and respect our hospitals, but to understand what the problem is and come together with a solution. And so, as I had mentioned before, there is legislation that is on the table right now in New Jersey, in the Senate, and in the Assembly, and we are working very closely with all of our partners at the table to try to figure this out and see what will really work for New Jersey. And so, that legislation has 4 prongs or 4 priorities, and so I want to go through them. And one of them is making sure that it is enforceable cost growth benchmarks, which put healthcare industry spending growth on a budget, right? We all are on budgets. The hospital industry also has to be on a budget. That there is accountability through an independent watchdog commission that mostly is made up of purchasers, and that there's a focus on price as a root cause through a hospital price growth benchmark and requirement for hospital price transparency, and to codify the federal legislation, federal regulations that are right now for hospitals. And then the last point, that resources and infrastructure of the state to maintain a database of healthcare payment data. We need to see the numbers to really study what is the problem. And so now that is the legislation we're pushing as a coalition in New Jersey. So Deb, what do you think is the most important part of this legislation, and how will it allow us to address the root causes of the healthcare affordability crisis?
So before I answer you directly, just the graph that you made mention of, the 100% growth, that is the graph that's out in the front hallway, right? Which is like my favorite picture. So if you all want to leave today and take a picture and point to that line and post it on social media, like there's the problem, it's that line, bigger than life, we can see it. But to answer your question about the legislation, which I think we acknowledge as a first step towards solving these problems. It has to begin with transparency, right? Put your cards on the table, turn them over, show us what they are. It's the combination of that transparency with enforcement mechanisms, because it turns out when you ask the hospitals, if you wouldn't mind, please, in your spare time, could you share with us your cost structure? They actually don't oblige, so it's got to have some, hammer along with it. But to me, I think the biggest thing about this piece of legislation would be the indicator of the culture shift.
Yeah.
Because for so long, for decades now, we've allowed the hospitals to kind of live outside of budgeting, right? Outside of, earlier today we heard, you don't go to the grocery store and put groceries in your cart. You don't buy a car and be like, bill me later, whatever you feel like. This is the only space which gets to operate this way. And it's been this way for a long time. So for me, this legislation would signify that we are making the first step towards a meaningful culture shift in the state of New Jersey, acknowledging that we have to rein in the hospital costs, and that I hope we're sitting down collaboratively with them to do it. And it would be a huge victory because it will overcome the barrier of our legislators, our elected officials, who are fearful because they get the Sunday night calls from the CEOs and vice presidents who, have had various positions in government over the time going, yeah, don't do that. We don't want you to do that. We appreciate it, but don't do that. So this victory is, yes, transparency and enforcement, I think, are critical elements in the bill, but more broadly, it's the culture shift that we will achieve by moving this.
Absolutely. And, Jillian mentioned we have a governor's race, and they're running on this whole idea of affordability. But then also what Dr. Dale said about transparency and accountability. We all have to be held accountable. We all have to show the books and be transparent if we all want to come together for the solution. And so, Jillian, how could this legislation help alleviate your challenges that you are facing in Morristown? But then also being a part of that New Jersey Managers Association, how does this help tackle the problem for you guys?
Well, I think the transparency is a big part of that in giving municipalities and the state health benefits plan, the health insurance funds, and the other entities that are responsible for healthcare for employees in New Jersey the tools in order to control costs. There is a huge black box right now with regard to a lot of components of healthcare. I won't go into that. I'll leave that for my drink over cocktails with Allie afterwards. But there's a lot of moving parts that really there's not an open book, and there needs to be. In order for us to reasonably manage healthcare, you have to have the information from which to make decisions, and that information is not being provided right now. Yeah. And there's been a lot of barriers put up, both for the state health benefits plan, but also the rest of us as well. And if you have the government really leading that effort to make sure that there is transparency and that there's a way for us to pull the cloak off of the information, then we can all make reasonable decisions and then hold everyone accountable. I think the second part is the infrastructure that the bill will mandate as part of this and give teeth to those mandates, I think is just as important as providing the responsibility for transparency. Both of those things together, I think, will go a long way to helping local governments and all of the entities that are responsible for this really controlling costs going forward.
Absolutely. One of the components that I had mentioned was the Watchdog Commission. And I think you said it about the teeth, right? There, in this legislation, there are pieces that talk about a performance improvement plan, right? I am a director at my office. We have a staff of 20. If someone is struggling, I pull them aside and we put them on a performance improvement plan. And we say, these are the issues that you are facing. These are the things that you have to make improvements on. What do you need help on? Let's figure this out together. So this legislation also has that kind of track record of creating PIPs, right? If at the federal level, hospitals are supposed to be sharing their information and they're not sharing it, then we need to be able to bring them in. This independent watchdog, right? This commission should be able to bring them in, ask questions, figure out what's going on, create a trajectory of these are the things that we need to get done or things that we need to address, and then be able to ask those questions, right? Nobody is above the law. Nobody, no body or no entity is above the law. So let's make sure that we are all creating a level playing field for us to be playing together. So I think that watchdog, the teeth of this legislation, I think is crucial. Deb, do you want to add anything before I continue? No? All right, so we have time for one more question, and so I'm going to open it up with, And I think you already alluded to this, Deb, but I'm going to ask it anyway. What patterns have you seen with the New Jersey healthcare industry that makes this legislation so timely? And it could go to both, so
Yeah,
if
do you
you
wanna start?
both want to answer.
I mean, just the increase in costs
I know.
is astronomical, especially in the last couple of years. And the state health benefits plan, I mean, they literally got like a death sentence almost with the most recent Aon report that basically says the thing is in the death spiral. And what's challenging is that you have, over 200 municipalities are members of the state health benefits plan. Many of them because they don't have a whole lot of other options, either because they're too small to really have a market out there for their members, or their claims experience makes them unattractive to the private market. But that was the intent of the state health benefits plan in the first place, right? It's supposed to be a state plan that provides a safe haven for municipalities to find affordable health care for their members and therefore for their taxpayers, right? And so if that's not functioning well, then it creates a situation where we're all suffering. Because at the end of the day, as much as we don't want to admit it, even like plans like mine, I'm a self-insured plan. We all model our plans off the state health benefits plan because all of the unions are looking at the state health benefits plan benefit levels, their premium costs, and they're using that as a benchmark, right? So if the benchmark isn't working,
Right.
then we're all suffering. The other issue too is that a lot of us are trying to make decisions based on data that's incomplete.
Yeah.
I can't emphasize that enough. When you're, in my case, 20% of my budget is healthcare. That's a huge nugget, and I'm making decisions based on like only seeing 15% of the information. That who
No.
does that? But that's essentially what we're all faced with, and the state health benefits plan is even worse because there's really no black box. You don't see any of the claims information, which is what you were talking about before. Part of that has to change for us to move forward, so we can all figure out a better, more cost-effective way.
Yeah, I mean, now is critical. I'll go back to where I started because people are deferring health care. We know it, right? We have a colleague who's part of the union who does a firefighter who does emergency medical calls too, and they had to spend an hour with a woman who had fallen down because she didn't want to go to the hospital because of the bill, right? Like, that's unacceptable. And I think we all need to begin the place from just saying that is unacceptable. The current system is unacceptable because people with insurance don't want to seek health care. Now let's talk about the people who don't have it. This is not an acceptable way, and the systems and structures that were set up are not serving us well. And I think we should also acknowledge these systems and structures were set up decades ago in a different world, before hospital consolidation, before a whole bunch of things that have allowed for this environment to take place. And we should stop trying to stick a square peg in a round hole, or accept the definition of insanity of doing the same thing over and over again and expecting a different result. 20% of healthcare in your municipal budget, next year it could be 25%. And how do you plan a budget not knowing that? So we obviously have to do something because we are in a crisis moment. And year after year, legislators somehow act surprised, and we're like, well, no, we told you this was coming. What have you done to change it, right? So we need to bring them those changes and those solutions. I think the other reason it's so important is that Governor Murphy, our current governor, did set up through executive order the Office of Healthcare Accountability and Transparency. And it only lives through executive order, which means through a transition in government, it could not continue to exist. They struggled really hard to get them a minimal amount of data they could to begin the process of benchmarking and assessing costs. We don't want to lose ground there, right? So this bill would codify that office, it would provide it more funding, more resources, and it would establish its place in government. So while I'm not a big fan of more bureaucracy, it is a necessary piece to rein in what is happening right now that's not working. And if we don't get the legislation through now, we run the risk of losing ground as opposed to accelerating progress at a point where even on the private market, there's no bargains to be found. I was talking with another colleague, I think Connor may still be here, so forgive me, I won't out the municipality, where they're trying to move from the state plan to a private plan. The state plan's at 36%, and they can save some money by going to a private plan. The private plan's 34% increase. I'm like, okay, I don't begrudge them trying to save that 2%, but it's not like they're getting a bargain on the private market. So it's across all public-private sector. We've got to address this, and that is I think the urgency, and I think that's why this coalition is so powerful, because it does bring together, you know, our nonprofits were saying they can't function because they want to provide health benefits to their 6 employees, which is now half of their budget, right? And we have the HPAEs on part of our coalition. They're on board because they know that their cost structures in the hospitals impact their wages and salaries the same way. And as a reference to what we discussed earlier, we do see the data. There is no correlation between the wages they receive and the cost of the cost of the hospital. So hospitals could say what they want about that. The data did not show it. And we've got to take action now before the whole system crumbles and we continue to let people, unfortunately, suffer and die.
Absolutely. And Deb, I mean, you said it, I was going to say it too, it is not the wages of the workers at the hospital that are causing these high increases. It is not that. And if Kevin Lyon, who is our former director of the police union, were here, he would say that these hikes have gone up, that it's 36, 21, 32%, and that it is not based on utilization. It is not because people are going more to the doctor. That is not the case. It is not the case that the GLP-1 medication is blowing this out of the water. That is not the case. And if we were able to see the numbers and have access to this, we can do so much more. At 32BJ, we are able to see the claims analysis. We have about 100,000, maybe more, members whose access we have of what's costing, what procedures are costing, what hospitals are costing us more. And for years, we went into a whole process of member education where it was like, these are the doctors you should be going to. These are the hospitals that are in network. This is what you should be doing with your healthcare, and really advocating for more information and for education of how do we do this. So that transparency thing is key. Now, to wrap up, I just really want to thank Deb and NJEA for being a partner, for Jillian sitting here and being a partner with us. There is no I in team. That is the name of this panel. And I think in New Jersey, we strongly believe that in coalition, we can build and we can do so much more. And it's coalition of our employers, of our unions, public and private, that the employers are sitting at the table. The employers fund this coalition. The employers fund this initiative because our employers love their workers and they don't want to be able to tell their worker that's been there for 20 years, hey, I got to give you less because now you're using your health care more. The employer doesn't want to be the bad guy either. And so us coming together and really solving the problem says a lot. And just last few things, right? 36% hike on the state health benefits plan in New Jersey. That just came out in July. And the numbers 3 years ago were double digits, and we thought they were incredible. They were
unprecedented. We would never see it again.
Thank you.
Right.
They were horrible, and now it's 36%. What will it be next? 40 cents of every dollar that we bargain goes to healthcare. And look at that graph. Take a picture of it. 100% on hospital prices, when groceries and housing is 40%. We know it's a struggle, and so let's really fix the issue, let's address the issue, let's come together, and thank you so much for joining us today. I'm going to hand it over back to our host,